Hello YouTube, this is Sam from Tigers Schooling. In this session of the video, we're actually going to talk about the ureter. So this is your ureter. Now this one, this thin structure you can find out here arising from your kidney and ending up into your bladder. So the ureters are actually thick. Let me remove the muscles in order to get a quick and better review. This is it. So the ureters are the two thick tubes which act to transport your urine from the kidney to the bladder, and they are approximately 25 centimeter long and are situated bilaterally with one ureter draining each kidney. Remember that the ureteric walls are comprised of smooth muscles which contracts to produce peristaltic waves, and this peristaltic waves propels the urine towards the bladder. If we're going to talk about the anatomical course of this ureter, this long structure, we'll be saying that the ureters arise in the abdomen as a continuation of your renal pelvis. They terminate in the pelvic cavity down there where they drain into your bladder in your pelvic cavity. So it is therefore useful to divide the anatomical course of the ureter into the abdominal and pelvic components, because from this structure of this part of the ureter is in the abdominal region, so we put it in the abdominal region, and down there it's in the pelvic part, so it's the pelvic part of your ureter. If you're talking about the abdominal part of your ureter, we were saying that the ureters actually arise from the renal pelvis. This is down there, this is the renal pelvis, which is a funnel-like structure located within the hilum of the kidney. So the renal pelvis receives the urine from your major calyx, which is under branching inside the kidney. The point at which the renal pelvis narrows to form the ureter is known as uretero-pelvic junction. Remember this one. The point at which your renal pelvis narrows to form the ureter is known as uretero-pelvic junction. So after that uretero-pelvic junction, the ureter descend downward descend after the ureter descend down the abdomen along your anterior surface of the psoas major muscle. If I'm going to add up this muscle, you will find out this is your big psoas major muscle, and this psoas major, and anterior to that you have got your ureter. And here the ureters are actually retroperitoneal structure, which means located behind your peritoneum. This is the ureter you can find out here, and it is on the both sides. So at the area of the sacroiliac joint, which is between sacrum and ilium, this is it, right over here. The ureters cross the pelvic brim. You know the pelvic brim, which is also called as pelvic inlet, which means you are entering the pelvic cavity. Thus entering the pelvic cavity, at this point they also cross the bifurcation of common iliac arteries. If I'm going to add up the let me show if the arteries are present. Here we go with the arteries, and you can see wait a minute. If you can see that, if we see at a close proximity, that this is your abdominal aorta, this is the common iliac artery, and this is the bifurcation of your common iliac artery. So this is your common iliac artery, and it divides into your internal iliac artery and external iliac artery, and between at the bifurcation it crosses anterior to the bifurcation of your common iliac artery, and comes downward into and enters into your pelvic region. So if we talk about the pelvic part of your ureter, we will be saying that once within the pelvic cavity, the ureters run down the lateral pelvic walls. You can see it is on the lateral pelvic walls on the both sides. At the level of the ischial spines, they turn anteromedially. At the level of, let me remove all these muscles and arteries. Let me give you a good picture of it. So at the level of this level, which is called ischial spine, they turn anteromedially, it means anteriorly and medially, moving a transverse plane toward your bladder. So upon reaching your bladder wall, the ureters appears its lateral aspect. You can see posterior lateral aspect in an oblique manner. So this creates a one-way valve. You can see this creates a one-way valve where high intramural pressure collapses the ureters, preventing the backflow of your urine. All right, this was about the anatomy of the ureter, and now let's talk about the neurovascular supply, which means arterial supply and your nerve supply. So, for discussing the arterial supply of the ureters, we divide it into the two supplies. That is, abdominal part is supplied by the renal artery and testicular in male, or ovarian arteries in female, and the pelvic part, which is down here, which is supplied by the superior and inferior vesical arteries. And venous drainage is carried out by the correspondence, right? And the nerve supply to the ureters is delivered via the renal, testicular, or your ovarian and hypogastric plexus. So your sensory fibers from ureter entering the spinal cord at T11 till L2, which means T11, T12, L1, and L2, with ureteric pain referred to those dermatomal areas as well. So this is it regarding your anatomy of your ureter. In the next lecture, we'll be talking about your bladder. So keep visiting Thai Schooling and make sure to subscribe to our channel. See you soon.